And you're welcome back to Morning Express. Now, for the last leg of interviews on the program this morning, we're being joined by Kabir Abdullahi, AMR, AMU, AMC Advisor, alongside Ifeyinwa George, AMR Program Manager, and DRASA Health Trust. Now, these two will be speaking to us on antimicrobial resistance, a new global crisis that is cutting across the world. A very good morning to you, Kabir Abdullahi. It's wonderful to have you join us in the studio. Ifeyinwa, it's brilliant to have you join us today. Now, but before we carry on, I think it might do a little bit of justice to your profile if you take us through what you do exactly.
Okay, thank you very much. My name is Kabir Abdullahi. I work with Management Sciences for Health, MSH in Nigeria, the country grantee for Fleming Fund Country Grant Phase 2 in conjunction with Mott MacDonald. I'm the advisor in charge of AMR, AMU, AMC. Thank you.
All right, fantastic. Ifeyinwa, can we have what you do?
Good morning, everybody. I'm Ifeyinwa George. I work with an AMR Program Manager for DRASA Health Trust. DRASA stands for Dr. Ameyo Stella Adedavo, a doctor who lost her life stopping the spread of Ebola in Nigeria in 2014. So this organization was founded in her honor, and I work there as the AMR Program Manager. Thank you.
Well, you're once again welcome to the program, and may God rest us all. Very quickly, let's start off with you, Mr. Kabir. Antimicrobial resistance is something that has been on the lips of many medical personnel, not just in Nigeria, but across the world. And it appears that the more individuals take more antibiotics, the more resistant they become to it. Now, this is the layman explanation to what it is. But from a medical perspective, what is antimicrobial resistance?
Okay, thank you very much. Antimicrobial resistance is the ability of microorganisms to resist or counter the effect of antimicrobial medicines that susceptible organisms that kill susceptible organisms or inhibit their growth. So when we talk in this context, we are referring to the resistance acquired by these organisms when the antibiotics or antimicrobials are misused or overused, because you have other forms of resistance, but the one in question here is the one that is acquired by the microorganism. And what does it do? As a result of this resistance, infections become more difficult to treat, thereby resulting in prolonged hospital stay and more expensive treatment alternatives, and sometimes loss of lives. So antimicrobial resistance really matters now. It's the new, I would say, the new threat to global health and development.
Now, Ifeyinwa, Dr. Kabir here has beautifully laid out that point. But from your own angle, what do you think are the impacts of this AMR that we're talking about? And being in the health, field and having seen a lot of things go down, what possible impacts do you think this might have had on the health of individuals who have had to go through, antibiotics treatment?
I'm happy for the stage that my colleague here has set, because AMR has a lot of impact on our lives. Okay. It cuts across sectors, from economic to health, to just even like it cuts across different sectors. For health globally, AMR has resulted in estimated 1.27 million deaths globally.
1.2
million deaths globally.
Okay.
And it's not talked about enough. People don't know that of this 1.2 million deaths, low and middle income countries in Africa, especially in Africa, bear like a 90% brunt of it, Nigeria being one of them. And in Nigeria alone, research has shown that over 260,000 deaths can be attributed to AMR in 2019. So when we look at this, we don't see what it's doing economically. And there's a projection now that says that if AMR is not curbed by 2050, we're looking at over $3.4 trillion losses globally in GDP. And that is just looking at it globally. For Nigeria, in the next By 2050, we're looking at 5 to 7% loss in GDP.
Due to AMR?
Yes, due to AMR.
Now these statistics that you have laid out are quite detailed. In your perspective now, or from your perception, do you think that perhaps the reason why AMR is quite prevalent in Nigeria is due to maybe over-the-counter medication that most people resort to, where if they have some sort of ailment or cough, they just go buy Ampiclox or Bicham and then just throw it down their throat and all of that? Is that the situation? That's
part of it. There are a lot of contributors, but of course human behavior is at the top of the list. Human behavior cuts across different things, right? We have the over-the-counter medications, as you say, and it cuts across misuse of antimicrobials, and that's just for human sector. And we're looking at using the wrong drugs. We should understand that antimicrobials are like a group of drugs, right? We have antivirals, antibiotics, antiparasitics. There are different ones. And then people don't even test for what the ailment is or what the causative agent is, but just start treating. I'm treating a virus with an antibacterial drug. That makes no sense. That's the wrong drug. And there are people that don't even finish their prescriptions. I take it for 3 days, I feel better, and I stop. Now, the doses are not enough to kill these microorganisms, and you're giving it a chance.
So there's a resurgence.
Yes, you're giving it a chance to learn how to, fight what you're trying to treat.
Dr. Kabir, you were smiling while she was trying to explain it. Yes,
she's very right.
Okay.
The two major drivers of AMR is misuse and overuse of antimicrobial agents, and she has touched on a number of impacts, but we'll still come back to the issue of access. Antibiotics or antimicrobial agents are not supposed to be OTC drugs. They're not supposed to be gotten over the counter. But because of our distribution system is still growing in Nigeria, somebody can just walk into any pharmacy without a prescription and get antibiotics. So the issue of access is driving misuse. And this is not just limited to the human health sector. A lot of the determinants of AMR are also found in the animal health sector.
Break that down.
Okay, thank you very much. In the animal health sector, you see a lot of overuse of antibiotics as additives to feeds. They are used as pesticides in farms.
Yeah.
And most of these activities leave residue in those products.
Either the animals or even the crops.
Exactly, even the crops. So, and some of these things found themselves into the food we eat. So if you say you're not affected because you're not taking drugs, at least you're taking animal and plant-based products. So you are still at risk of antimicrobial resistance. So the impact is so wide, it cuts across so many aspects of human life. And like she said, human behavior is at the top of what is driving this through misuse and overuse of essential antibiotics.
Now you have highlighted human behavior as part of the enhancers of AMR in individuals across not just Nigeria now but globally. But let's also take a look at other causatives from your perspective, Ifeyinwa. What other human behaviors do you think cause or enhance the dangers of AMR?
We say human behaviors are at the top because we are the determinants in most of it. Even in the animal sector, we're the ones feeding these animals with antimicrobials. Some people use it as growth boosters as well. They say it makes the animal grow bigger. And we all like to buy that, broiler at the market that looks like it's well fed.
Especially during Christmas.
Yes, during Christmas that just passed. See people selecting them like that. So human behavior is at the top. And at the same time, other than, it being used, antimicrobials being used by humans and even in the animal sector, we also have poor hygiene leading this. Infection prevention and control is wash facilities are not where they should be on the African continent and in Nigeria as well. So basically, something as simple as washing your hand can stop a resistant microorganism from being transferred to your colleagues. So hygiene is not where it should be. People don't take it seriously enough. Wash your hands, respiratory hygiene, don't sneeze on your elbow, things like that. So we have very poor IPC and wash habits in the country, and even wash structures are inadequate. So basically that also helps to spread these resistant pathogens. They have picked up the resistance, but by washing our hands and, you know, observing all of these hygiene practices, we can prevent them from being passed on and from being spread across the communities.
Now I remember during the height of COVID, the regular hand washing, sanitizing of hand, usage of face masks and all of that was well advocated for. And much recently, we had a little scare with the HMPV, virus stemming up from China, even though the WHO has said it's not a global health crisis yet. But in terms of orientation, in terms of communication, as to how important regular hand washing and sanitization or sanitizing of hand is, even when there is no epidemic around. How much are you doing as health officials, maybe in collaboration with the National Orientation Agency, to enlighten people with regards to the importance of this?
So I'd start with the government. At least we do some work, especially with NCDC, the Nigerian Centers for Disease Control and Prevention. And IPC, Infection Prevention and Control, is big for, controlling AMR. Basically, it's a big sector for public health initiatives. And it is one of the pillars of the National Action Plan on AMR. And we do some work around community health and hygiene, basically going into the communities and trying to help them imbibe these habits and ensure that, you're washing your hands. Even in hospitals, we try to push IPC because it's important to, sterilize instruments used within the hospital.
Which is standard practice.
Yeah, standard practice. Gloves. You would say standard practice, but you'd be surprised at how, what's the word now? How this can just go without being done even in the healthcare setting.
Healthcare centers.
You could surprised at how suboptimal it is, even in healthcare settings. So basically, we go into the communities, we go to the healthcare facilities, especially at the grassroots, and we try to inform these people, ensure that this is done. Hand sanitizers, gloves, sterilized equipment, just basically ensuring that you are not transferring pathogens from one patient to the other. And even within our communities, wash your hands. Even we have school programs that we implement in schools, secondary schools, teaching children how to wash their hands, just to catch them young and ensure that these habits stay with them. So that's just highlighting some of the work that we do. But even the government, like I said, there is a pillar for infection prevention and control, and that pillar basically implements across board from the grassroots to the health care facilities all the way up. So basically ensuring that people are aware of what needs to be done and how well we can push, these good hygiene practices within the communities.
All right, brilliant take. Now, Dr. Kabir, back to you. Still talking about the issue of, sensitization, communication, and all of that. What are your thoughts?
Okay, yes. One of the strategic objectives of the second NAP, the AMR National Action Plan, in Nigeria, which was launched last year by the Honorable Minister for Health, is education and awareness. And that underscores the importance of communication. So it's a pillar under the National Action Plan. The Nigerian Center for Disease Control through the National AMRTWG is actually leading the charge in implementing that plan with support from partners like Management Sciences for Health. So we're taking, first of all, she spoke about what is happening in the community. I want to take it from even the healthcare facilities, because a lot still has to be done in that space. So we need to enlighten our colleagues to the effect that no treatment or no antibiotics should be prescribed without clinical or laboratory investigation.
Now you are saying this because perhaps you are looking at it from the perspective of pharmacies in urban or city centers. How about places or communities where perhaps the only access to healthcare that these people have is a small, as we call it, chemist store, where somebody sets up a small shop, buys some medication, and that person serves as their doctor, their nurse, their midwife, their pharmacist, their healthcare therapist, everything. That is the only access they have to healthcare.
Okay, so that is what I meant by we have to look at access as holistically.
That's possible.
in my view, I think government should give the kind of attention that is being given to narcotics and control drugs to
antibiotics as well.
Yes, that regulatory control is required. It is as important as that. I mean, look at the numbers. The numbers speaks for themselves. So we need to regulate access to antibiotics. So whether you are in a small primary care center or you are in a big teaching hospital, before you are able to access antibiotics, you should have gone through a prescriber, and that prescriber should have run some investigation. So I think we need to begin to look at antibiotics in that light, so that
in the same level with narcotics, and the rest.
It's as important as that, because you see, if we don't do something now, like she said, by 2015 we are looking at about 10 million deaths as a result of AMR. Globally, that is huge. It could be even be more. So
that could be higher than the effects of COVID globally.
That, to be honest with you. So we need to begin to consider that regulation, so as to be able to control access. So by the time you do that, the person, the case you gave, that somebody in the local government, yes, we're not saying you will not have access, but you should have gone through certain steps, processes before you are able to do that. And then instruction to the patient should be well followed. We don't take antibiotics without being given some form of instruction on how to use it, dosing, duration, and stuff. So those are some of the things she talked about, that we need to be very, very, very careful when we're using antibiotics, to follow those instructions given to us.
And in some cases, most people take over-the-counter medication, and you know, they tell you that the more number of medications they throw into their mouth, the more effective it will be. Now this, I know that these are all wrong, but in closing, we have just about 3 minutes to wrap up this conversation, I'm afraid. Ifeyinwa, let's just get your recommendations before we let you out of the studio, with regards to AMR and how we can collectively, you know, fight and ensure that we keep Nigerians safe from it.
Okay, so I'll do top to bottom. So basically, or bottom to top first.
Okay. So
basically, while we expect, you know, the government and the policymakers to come in and actually make policies, like he said, that regulates the dispensing or the procurement of antimicrobials, we also need to look at ourselves. It's a collective effort. We all have to work together to get us to where we need to be as a country and as the globe at large. So basically, us spreading the word within our communities and being able to, you know, do the right thing, have these habits that ensure that AMR is not, you know, just emergent, like antimicrobial resistant pathogens are not emergent. Basically, do not do the over-the-counter antibiotics or antimicrobials. Do not self-prescribe. Do not take them without a prescription or proper diagnostic test. So we do all that. Talk to your neighbor. Talk to the farmer down the road that is feeding it to his chickens. So basically, within ourselves as a community, imbibe good hygiene habits and all of that. That's one. As a country, basically, we look at multi-sectoral coordination. AMR, we're looking at it from a One Health approach: animal, plants, human, and environment. So basically, all sectors need to work together to, you know, mitigate this global crisis at, you know, at different levels, and collectively the impact will be bigger than if just the human health is working on this. And then we also need to look at, you know, funding is extremely important. For every public health threat, funding is important. So we need to have domestic funding for AMR within the country. While we have all of the international organizations that support Nigeria, and I know that the Nigerian Centers for Disease Control and Prevention has some funding, it is not sufficient considering the costed, you know, One Health National Action Plan on AMR that was launched this year. It's not sufficient to implement all of the activities that are outlined there across the sectors. So we need domestic funding. We need commitment, you know, from the government and from the ministries to fight AMR together. We need that domestic funding, domiciled here in Nigeria, for the Nigerians, by the Nigerians, that says this is assigned, you know, to AMR, because we do not want a world where antimicrobials do not work. There's so much that could go wrong. It is beyond anything we have seen. There's nothing you do in the hospital. Disease treatments mostly are antimicrobials, even for surgical procedures, chemotherapy. We're looking at a lot of things. So we kind of need to work together to ensure that we don't have to experience that world where these very few antimicrobial agents do not work.
Well, I would have said mic drop, but you don't have a mic in your hand. Dr. Kabir, just in about 60 seconds, your thoughts.
Okay, thank you very much. I think you have said a lot. Well, I would just like to add that we need to continue to work together. The determinants of antimicrobial resistance cause across human, animal, environment, and the plant agriculture. So we need to continue to work together. I know the Nigerian Center for Disease Control is doing a lot in that aspect. Then, like she said, I want to emphasize a point she mentioned, resources. We cannot continue to rely on partners for a lot of things. We need to begin to look at other ministries as well. So if we want them to work together, we have to support them with the required, resources, so that we can do so many things that we need to do, both within the sectors and even in the community, so that we can increase the level of sensitization in the community
and awareness
across.
Yes.
One of such is what we're doing right now, but we need to do more of this so that people can be aware and they know their role, the role they need to play to curb the menace of antimicrobial resistance.
Well, I couldn't have said it any better, but we must thank you so much, Kabir Abdullahi, for finding the time to come on the program. And thank you for sensitizing us. I have been enlightened personally. Ifeyinwa, it's been a pleasure.
Same here.
Thank you so much.
Thank you very much.